It's been revealed that the largest healthcare provider in the state has sued more of its patients for unpaid medical bills in the last 3 months than any other major medical system in Colorado. UCHealth has been suing patients several times a day, day after day, and year after year. Earlier this year, UCHealth told 9 News Investigates that its practices were in line with other systems in Colorado. However, our very own Chris Vanderveen found out that simply wasn't the case. I want to bring in Chris now to talk about what he learned and what the 9 News Investigates team found out. I know you've been digging into this for years, but this is really interesting.
Yeah, and it really was a project that really started out of curiosity, mostly which hospital system was suing on unpaid medical debt the most. We ran into some roadblocks, aired a few stories earlier this year, stories that helped change state law, and then allowed us to do this latest story. Now, it all starts with patience and a few curious stories.
They arrive on foot, documents in hand. Personal deliveries of bad news.
Yeah, I have to submit some paperwork.
Process servers have this down. A knock on the door, a summons, a complaint, a lawsuit, and an amount.
When is the first time you find out you owe them money?
When I got served by a deputy, I got served paperwork, a summons to appear in Grand County Court.
Dan Mayer received this summons in October. It informed him the business suing him was also the business that helped save his life.
I was diagnosed with metastatic melanoma.
A little scary?
It was. I remember when they called me and they said, "We've got bad news, it's melanoma." And I said, "Is that bad?" And the dermatologist kind of said, "Yeah, it is."
UCHealth wanted $3,969.50. Odd, considering UCHealth's own web portal told him this.
When your balance says zero, you think you owe
Zero.
So you still don't really know what's going on.
No.
But they're suing you,
Yes.
and that doesn't feel good.
No. Not at all.
Ayla wanted us to use only her first name. In September, she received this summons notifying her UCHealth was suing her for $1,828.19. Also odd.
This is crazy because I just finished paying off all of the debt. I was like, what the heck is going on?
Odd, considering her online portal indicated she too owed UCHealth nothing.
I know I worked so hard to continue to pay that bill off. And then for it to come back like 3 years later, I was so appalled by it.
That's so relatable because we've all been there where, you struggle to pay medical bills, you pay what you can month after month, week after week. And what is it like to rectify the situation? Is it easy? Can you just show, hey, I've paid this?
No. And I think there's lots of advice I can give people. We've done these stories for a number of years. I think really the simplest advice is if you get sued, it is serious. When you get a summons, somebody shows up at your door. This is how the process works. They show up at your door, they issue a summons, and they're going to tell you, you need to respond by this date or you need to go to court by this date. Lots of people, probably 2/3 to 3/4 of people who get sued by medical systems in the state of Colorado ignore those summonses. And I can tell you, when you ignore those summons, you're going to get hit with a default judgment. And the default judgment means that now the court and the plaintiff have a lot more options at hand. And one of those options is to actually starting to garnish your wages.
Have you seen that happen?
Absolutely.
Really?
In a couple instances, here's what's interesting is that we found a couple instances that UCHealth has been doing these lawsuits for a number of years. And what they'll do is we found a few dozen instances where they actually garnish the wages to try to secure the payment of the debt. In 2 instances, UCHealth had to attempt to garnish wages of their own employees, people who worked at UCHealth, who also received treatment at UCHealth. And this happens. And look, the argument from UCHealth, although they have not responded to our story, we wish they would, but they have not responded to our story as yet. The argument from UCHealth historically has been, look, Chris, these are people who owe us money. We should be entitled to receive money that is owed to us. And I think that's a valid argument, except for the fact that we're finding a lot of people who are getting sued on bills that they don't even know about. The 2 people that we talked to in this story, they went to their portal and it said zero. They say they never got this notice in the mail from a collections agency saying that they owed money. That's not how this process is supposed to work. It shouldn't work that way. UCHealth says they go to great lengths to notify patients. Hey, we will call them so-and-so number of times. We will notify them in the mail. This should be no surprise. But I talked to a woman, get this, she found out that she was getting sued because she left work one day and her boss called her and said, hey, you need to know this, but some paperwork just showed up. They're garnishing your wages. She didn't know she was being sued until then. That's a problem. That's a problem with the system.
I mean, it sounds criminal to me. I mean, don't you think at some point they're going to have to answer to this, whether it's to you or to the law, to someone?
Yeah, I mean, the crazy thing is I think that the law does allow this. I mean, there's
Wow.
wide liberty in the state of Colorado when it comes to collections cases. And I think collections attorneys will argue, maybe rightfully so, that, look, there has to be some teeth to the law that allows us to collect this money. But the problem is that I think when you get aggressive healthcare systems, and I think we can unequivocally say that UCHealth is an aggressive litigator in the state of Colorado. There are no other hospitals that we found that litigate this much. And when you're that aggressive, I think what we're finding is that there are some people that may not owe you the money, and they're still being sued. And therefore, the onus is on the patient to raise their hand and say, hey, hold on a second. I think you're suing me on money. But a lot of times, like sometimes they're getting sued on cases that are like 3 years old. People have switched insurance companies. They may not know what this is even for.
Right.
Lots of confusion. And I can sympathize with hospitals to a point. The billing system is a mess. Insurance is a mess. We all know that. But at the same time, it's like, come on, this is not fair to patients.
Right. Where does it cross the line of being intentional? You know what you're doing.
Yeah.
And let's get to the bottom of this. We know you are not done digging into this.
We're not. I think we've already gotten a lot of interest today. I've already heard from more
good.
patients that are confused. This is a problem, and I think it is time for UCHealth to answer some pretty tough questions about what exactly is going on over there. If there's nothing to hide, as you told me back in February, then show us. Like, there's nothing to hide. I'm willing to believe what you want to say, but why is it, as I told them back in February, why is it so easy for me to find patients that don't necessarily fit their narrative? That Chris, these are just people who owe us money. They need to pay us. That we've told them a million times they owe us money, and somehow we need to collect that. I'm not finding that.
Well, I think those people, the community of Colorado, everybody deserves answers. Hopefully we get those and you'll bring them to us
Yes.
when you know exactly what's going
Yes.
on here. All right, Chris Vanderveen, we appreciate you.
You bet.